Okay, we are live with Coffee Break with Coachman, my interview podcast show that goes live every Monday, 6 p.m. Europe time. And today we're going to be interviewing a slightly different interview because we're going to have a little lecture, introduction, and then a discussion between me and Dr. Rafi Romano, an orthodontist from Israel, but a dear friend as well, but a specialist in digital orthodontics, one of the top Invisalign providers in the world, one of the guys that most understand Invisalign and CleanCheck. He's part of the Align Advisory Board and is part of their group of developments. He's heavily involved also with the DSD ideas, always helping us with his experience. So I believe this is a very hot topic. You know, people all over the world always ask me, I want to understand better what is digital orthodontics, what is aligners, what is the collaboration between DSD and Invisalign, how this may help me provide better orthodontic treatments to my patients. So this is exactly the topic of today with Rafi Romano, one of the best experts on these topics. Ortho, artificial intelligence, digital dentistry, and how can we bring tooth movement in this new environment. Rafi, thank you so much for joining us. It's a great pleasure to have you here on my little show. And I'm sure that people watching us will enjoy the content because I know you are not only an expert, but you are very pragmatic, straight to the point, very honest with your opinions. Besides the know-how that you have, the scientific know-how, you are a great clinician. So what you do is really what you say is really what you do, right? So things need to work clinically and they need to be the best for your patient. So I always love to talk to clinicians that really understand these new trends, but are very pragmatic when it comes to using this for real on a daily basis. So Rafi, thank you so much. Give your initial hello to the DSD community, and please give us a little background about who is Dr. Rafi Romano.
So first of all, Christian, you know, it's a big honor to be with you personally and with all your community. I think, you know, looking back at your background and my background, you know, I think we are here mainly because of our passion to teach and to inspire people. You know, the business side of DSD or my clinic or whatever advisory board that I'm in is only because of the passion and the passion to know more and to understand deep and not to get any information that I will present today as, you know, something that comes from the God, the commercial company, and say, all right, thank you, I'll do what you and I'm trying all my life when I teach or when I treat to try and understand what I'm doing. And this is what I will try to show you. I don't want to, you know, make this coffee break heavy. It's coffee break. So I prepared some really, you know, taste of what is artificial intelligence in orthodontics. So with your permission, I will share my screen so we can.
So this is how we're gonna do. You're gonna have this this little lecture about these concepts, and afterwards I'm gonna start with some questions, and then we're gonna just brainstorm over the topics that you showed. So go ahead and share your screen.
Right.
Share your screen.
I did. Do you see it now?
I see you. I don't see. I think Marta needs to.
Okay, so I think Marta need to do something to make it happen, because I already shared my screen. Marta. Okay, don't worry, guys. We didn't go anywhere.
We need, yeah. So Marta, please check with Brandon. Give Brandon a call. This was and
Okay. So let me go back for a minute, to us. You still see me, right?
I see you perfectly. So let's start.
Okay.
Marta's gonna
Okay.
Marta's
Okay.
gonna find a solution. Let's
Yeah.
start with a brief
Okay.
explanation
Okay.
of
Let me explain. I during the corona. First of all, during the corona time, we had a lot of time, all of us.
yes.
So I was watching a lot of your coffee breaks, and one of our friends, one of your best friends, and my inspiration, Kyle Stanley, is probably leading today the inspiration of AI in dentistry. And I mean the new eras. You started with a smile design, but he's going deep into areas that we didn't think about.
Yep.
And when I prepared this lecture, I thought that at the end, orthodontics is about AI. And there is a lot of today with digital orthodontics, people think that digital orthodontics is scanners.
Mm.
Digital orthodontics is CleanCheck, which is the software to plan your Invisalign, but it's not that. There are algorithms that I hope that I will be able to show you that actually. Sorry, Christian.
Yeah,
Yes.
I want to start. Actually, I have two. Perfect.
Okay, I think now we are getting the screen. Let me see.
That's you.
Can you see it now?
Yep. Perfect.
Perfect. Okay. So, first of all, just for people who do not know me, I've edited 5 books in dentistry, 4 of them with Quintessence Publishing. You have my website, my Instagram, Facebook, whatever. And I'm still married, even that I'm traveling a lot, to my beautiful wife and 4 kids. Emily is now 17 and Lian 16. Ili had a bar mitzvah, which is what we have Jewish people, when they become 13. And Adam is 11. And this is my clinic and my stuff. I have more stuff, but if I put more girls around me, that could be a sexual harassment. So I invited only 4. So and this is, by the way, another thing I did during the Corona time. I posted a video to guide people, our friends, dentists, how to manage their clinics during the coronavirus time, how to protect themselves, how to prepare the waiting room and everything. And until today, already in 4 weeks, we had 120,000 views around the world. It's amazing.
Wow.
People find it very useful for them. So, of course, all your viewers are invited to look at it. It's in YouTube, very easy to find. So enjoy. Now, artificial intelligence is what people call machine intelligence. And today, more people afraid from the machine intelligence rather than adore it. So I will try to explain you today what the difference between what the machine is doing and what we are doing. And there are intelligence agents. And as I remember, what Kyle Stanley said is the more data we have, the more we get, information of how automatically to do whatever we do. So I thank you, Kyle, for the inspiration. Of course, you, Christian, for the many years that you inspire all of us and our friendship. So one of the companies that are leading now today with Kyle is in Pearl, and which deal in identifying X-rays, and Orca, an Israeli company, very nice company that is dealing with transforming CBCT into STL files in seconds, identifying where the nerve is, where impacted teeth are, and all of it in seconds, based on artificial intelligence about identifying CBCT points from hundreds of thousands of images, and giving us, the dentist, a lot of data. So that this is, let's say, a more static AI. It's not dynamic, it's more static. It gives you a lot of information, which even the video here moves. There is no actually dynamic information. So
basically, if we can divide artificial intelligence in dentistry, of course, there are many areas where artificial intelligence is starting to happen in dentistry. One of them is what you said, static. It's basically artificial intelligence helping us to interpretate images, see what is going on with an image or a CBCT or an STL or a radiographic image, and basically the artificial intelligence will learn how to look at that image and give us reports that very soon will be better than an experienced dentist looking at an x-ray, for example, looking at a CBCT, right? So artificial intelligence is getting there. But there are other areas, right, where, for example, we work a lot on artificial intelligence in smile design. It's a much more objective, much more complex.
That's where I'm getting now, Christian, because that's exactly what I wanted to say, that what you have started many years ago is taking the smile design throughout the years into becoming an artificial intelligence smile design. And you know, there are many companies that try now to give what we call smile design, but the prediction is not so good because they don't have so much data like the DSD community, like Invisalign that has more than 8 million smiles. So if you integrate everything, I think the one word that pop out is the prediction. Because when you have a lot of information, you can have a good prediction on all these topics, from the diagnosis all the way to the retention. And each one of the topics is like swimming into artificial intelligence dynamic information. So I concentrated on very, like a taste.
There's a little sticker, Rafi, there's a little sticker over your slide. I don't know if it's on your computer or Marta's.
No. It's on purpose, where you see the diagnosis.
No. Hi, there's a little.
Over there. It's short story. Hi.
Yes.
Good. All right. So the first one is, of course, with appreciation to DSD and to you and to whatever you did, is a nice DSD case where I had this nice patient, which I can tell you that without the possibility to have the artificial intelligence knowledge of DSD and Invisalign, I would never know what should I do with this case. She has a missing upper lateral incisor. Midline is off. Aesthetic is very, very poor. There is a big crowding on the lower arch, and some crowns and implants over here. And you know, when you get to these cases, you are in the dark. Everything is vague, and you have to start guessing where you want the smile to go. And one of the nice tools that DSD has, and this case was done with my friend Shlomi Dagon. He's part of the DSD community and a very, busy doctor with DSD in Israel. And he uses your app in order to send me some suggestion, that he did very, very rapidly on his iPad to try and see what kind of smile he can have. This is something really static that he's doing in front of the patient. So now, there is the beautiful thing that I still believe some people do not know about the collaboration between DSD and Invisalign. And what is this collaboration? DSD is actually giving us a tool to be able to start playing, to start shuffling all the case and trying to see what are my options. Everything virtually, everything digitally, and everything based on artificial intelligence knowledge about what shape of this teeth has, what is the size of the face, the size of the lips, the size of the smile. Everything is integrated, and correct me if I'm wrong, Christian, automatically, of course, with the human touch, but with the more cases, the more years you have with DSD, the better suggestion I will get from the DSD for this case, right?
Exactly.
Okay. So, I will not get, deep on any case because I want to run it like a more open discussion very soon. But you can see here that we had one option, which is the best possible restoration and post-orthodontic treatment that DSD offer. But I get also some other options besides of getting a full restoration. I get an option of 4 veneers. Instead of the cuspid, to turn it into lateral incisor and get only 4 veneers. And then I got recommendation to have maybe 5 veneers, because you can see here that the premolar has to be reshaped like a cuspid. So I got an offer of 5 veneers. And now I can take all this information and transform it into the system of Invisalign and DSD. So now what happened is that I can take every suggestion and do the plan according to where the teeth should be for the perfect DSD that I choose. If I choose a 4 veneers, a 5 veneers, or full restoration, I can do the play, see the face on the left side, see the teeth, see exactly how much stripping I need to do. So this is a dynamic interpretation of the artificial intelligence I got from DSD into my work on a daily basis. And that's something that is not only unique, it's revolutionary, because it's not anymore about guessing. It's really, accurate. And the prediction, as you will see, of the planning and the DSD is so precise that I can show you, what we got here. That is the superimposition of the plan. You can see the blue and the white, which of course the blue is the situation now and the white is where I want the teeth to go. And you can see how accurate this is at the end of the pre-prosthetic stage. Not a very aesthetic smile, but every tooth is located exactly where the prosthodontist and me wanted in order to do the final restoration. So that at the end of the orthodontic treatment, you can see that the clean check on the left side and the alignment of the teeth on the right side, this is pre-prosthetic stage. Everything is exactly like we planned. This is a lower arch. And here it is after the prosthetic result. So, being an aesthetic in the European Aesthetic Academy, I can tell you this is a very nice result with a good gingival, reaction for the restoration and good occlusion, and everything was predicted and very nice. And thank you, Shlomi and Rami, for a wonderful cooperation together. So this was an example of artificial intelligence in smile design. So another thing that this is a before and after. I think, it's an amazing improvement. But what really made me very happy is the option to predict this final result in the first moment that I saw the patient.
Let me ask you one thing related to this moment here, because of course I'm not an orthodontist. So from your orthodontic perspective, how many times you think an orthodontist is planning a case, thinking that ortho will be enough, and at the end ends up realizing that restorations will be needed afterwards, right? Because from the restorative standpoint, we always talk about the fact that many times the restorative dentist is not seeing the need for orthodontics and missing the opportunity to offer this opportunity of a pre-restorative ortho movement that can improve the restorative outcome. Now, the other side is that I believe as well that orthodontists are many times believing that aligning the teeth will be enough, and many times restorations are needed afterwards. And if this is the case, this type of technology can really help orthodontists to understand if the case is pure orthodontic movement or ortho plus restorative, and can help the restorative dentist to understand if this is just 6 veneers or can we improve movement and then restorations. So do you think it's a common problem?
It's not only common. I think it's one of our biggest problems in orthodontics. You know, orthodontics was for many, many years a profession that was not connected to any of the other disciplines. And, you know, when I joined the European Academy of Aesthetic Dentistry like 25 years ago, I was probably the only orthodontist. And I was shocked because to me, every case, and I mean every case, and Nitsan can tell you and others, you know, every case that comes to my office, get consultation from prosthodontists and periodontists before I start. And every option is on the table. And I can tell you, of course, that sometimes, you know, a patient is not ready, is not cooked for a full, you know, touch-up for aesthetic. But at least this is discussed, this is simulated, and this is on the table.
Yeah, regardless, I think regardless if the patient will want to do it or regardless if the team will decide that this is the best option, I think the most important is to make conscious decisions by understanding and visualizing all the options before even touching the patient, understanding exactly how good the treatment may look only with orthodontics and treatment may look with ortho plus restoration, so you can make a conscious decision to start with.
And this is exactly what we discussed some days ago, me and you, Christian, that, you know, the DSD collaboration is not only like a technical thing. It's not only providing the dentist with beautiful design of teeth, you know, to plan with their Invisalign. It's like the option for dynamic visualization of what they want to get. And this is what AI gives us. It's the machine, the computer, the design is given to you, and you cannot ignore it anymore. It's something that is here, and you should take it into consideration. You know, like Kyle said in his lecture, he said, you know, when you diagnose something with the AI in an X-ray, and the doctor prefer to ignore it, then he will not be able to tell you later, you know, I couldn't notice it. It was there. It was reported to you. And then you can write in the patient file, I saw it and I decided not to treat it, you know? So same for smile design, same for everything that is in the pre-operative, you know, treatment plan before you start the treatment.
Definitely.
All right. So another thing that I'm really, really excited is the option to do simulations. And I can show you, you know, this is a case, very interesting one. I did just recently. I finished it in January, just before the corona. And you can see this case, he had 2 previous failure orthodontic treatment. And he came to me around 2 weeks before he was about to have an orthodontic surgery to correct his open bite and failure in the treatment. And you can see that the orthodontist put for him some cribs for tongue thrust. And I felt that part of the problem, you know, patient come to you and you want, you know, a chair side to be able now on a chair side to do something to give an answer where I can go. So today, and you can see, you know, I'm passing through the slides to see some of his diagnoses, and he is a high angle case, open bite, class 2 case. So, you know, the first thing, I use my scanner and I scan the patient. But what I can do with this model, this is actually a dynamic but static model. You cannot do anything with it. It's just a picture. people are excited from 3D model, computer models that they can move it, but it's nothing. It's just a picture without anything. So the ability to do the simulation is based on artificial intelligence. There are algorithms, automatic algorithm that will tell you if you move the mandible forward, how the profile will look. If you move the teeth, how the teeth will look. So, in the past, people thought that simulation you need only for marketing. You can show the patient, so patient will pay for the treatment immediately because he's excited. I believe it's much more. It's patient education, it's chair-side planning, it's alternative. You can check many alternative options on the simulation, and you can implement your functional and aesthetic vision, because each one of us has his own vision on aesthetic, on stability, and on everything. So part of the thing, and this again, we talked today about artificial intelligence. This is turning the picture, which is STL, it's like JPEG, it's nothing but 3D picture, into a segmented model where every tooth is identified. So there are many options, and I know, Christian, that you were a master of 3Shape auto analyzer, doing segmentations and moving of the teeth. But look, today we have the option to have an automatic algorithm where the segmentation and simulation is done in 1 second. So on chair side, I have the iTero. I can do scan, automatic segmentation, and simulation. Simulation is based on AI algorithm, and same like with 8 million Invisalign cases, there are probably around, 30 million scans that Invisalign has or more, which they can integrate into the simulation and provide us with some simulation, as you can see here, chair side for this case. So you can pop in, Christian, while you see it. You can see that all the segmentation is done automatically. You can touch the screen and stop it and do your changes whenever you want.
Yeah, this is it's something that it was hard to imagine, even 5 years ago, to imagine that this would be so easy, so available, so real. And as you said, this is not only marketing. Your previous slide, I loved it. I did a print screen here of your slide. When you're doing simulation nowadays, it's not just simulation for marketing. It's everything you mentioned. It's visualization, education in the beginning of the journey of team communication. It's activating your brain to start seeing possibilities. And on the look how nice, 60 seconds, right?
Yeah, and now that was the automatic simulation done by the iTero. And now, of course, it's time for you to put your vision. That's the interaction between our brain and the machine, because you can have 5 doctors doing Invisalign, you get around 7 different treatment plans. And this is because we have, as doctors, we have some vision about what is the best function of the occlusion, the stability, the aesthetics, the biomechanics, his habits. Why does he have an open bite? And put our experience as dentists for so many years. We know what works in our hands, what doesn't work in our hands. So all this goes into what is inside the iTero, which is called modification. So we can now go into the simulation, modify it with our touch, doing a little bit more extrusion to the tooth, more expansion, changing the arch, getting to the best occlusion, everything done chair side. You remember, this is the first appointment that the patient is in my clinic. And I already can show and get a taste of where I'm going.
So there's three things here. There's the artificial intelligence generating a super fast initial 3D tooth movement. Second, there's the possibility of you refining what artificial intelligence gave you, meaning that not only you can explore different options, but it becomes like a real time explanation for the patient. You know, if the patient says, no, but I think my teeth are too short or the gum line is not nice, as you communicate with the patient, you can translate your ideas live by making chairside modifications, right?
Yeah, let me make you more excited now, Christian, because after you did it, look what I can do. I can share my vision and my simulation now with so many people. Of course, the first one will be the patient, my dental team, my technician, my prosthodontist, whoever. I can share with my colleagues, when I teach, and I can share with the technician. So now we have an option both to save the simulation, then to share, and to send. What does it mean to send? I can send the simulation to the Invisalign technician and to DSD laboratory. They have already in their hands my vision, where I want the simulation, where I want this case to go. I already invested time in expanding the arch, extruding, leveling the gum line. They have already my vision. So now when they got into computer and my touch, they have now 2 minutes to prepare a plan that will actually fit exactly what was my vision. So I save time, I save a lot of interaction and writing and comments, because this is a dynamic visualization of everything that you think about the case.
Now, I also, something that also Invisalign is developing is not only the simulation, but they're starting to enter through artificial intelligence as well, to depending on what the ideal tooth movement is, depending on where you do this quick movement, saying this is where I want, the computer is starting to evaluate how complicated the movement is, right? Already giving you some insights about, this is an easy case, this is a more complex case, this is an easy movement, this is a complex movement. Isn't that right?
Yeah, it's they are now it's like a wizard. When you go to your phone and you touch something, you have a balloon that tells you, yes, here you can touch, here you can do there. So today people understand that we need guidance, and guidance doesn't mean cookbook. It means to give you light, like good, putting a lot of light in the room that tell you, okay, now if you want to do this, for example, extrusion here, this is a big extrusion. We suggest that first of all, you will have these attachments. Second, that you will do staging, meaning that you move the central first and then you do the expansion. So you get a lot of help from different colors, different degrees of the movements and suggestion, and everything is based on what we started our lecture, artificial intelligence. It's not a technician that actually sits in the lab and tell you, you know what, I think it's difficult. It's like more an automatic procedure. If you want to do a 3 millimeters or 5 millimeter extrusion, be careful. Now there will be 1, 2, 3, 4, 5 that will happen from it.
Now, let me ask you something that I think it will lead us into a very polemic, let's say controversial discussion here, but I think it's very important. We know, as I said, that artificial intelligence is getting into many areas of dentistry. But don't you think that biomechanics is the one that will be impacted first and more deeply in dentistry? Meaning, it's much easier, in my mind, is much easier for a computer to learn biomechanics and how to move teeth to the right position according to the bone, according to the soft tissue, according to the face. These rules, let's say, are easier to teach to a computer than, for example, how to design a smile, how to understand the psychological, subjective desires of the patient, how to prep a tooth according to a specific material. you know, how to make an implant placement, how to make an endo treatment, how to perform an orthodontic surgery. So I have a feeling that, and Invisalign is proving that artificial intelligence, the first specialty that got into artificial intelligence in dentistry was orthodontics. And I have the feeling that orthodontics will change drastically on the next 5 years.
I cannot agree more. I can tell you something that, you know, I have this, my own, vision and mind on the role of artificial intelligence in dentistry. I think many are against it because they're afraid, especially orthodontists, you know, they feel that they are the master of biomechanics. They are the master. Nobody can do orthodontics beside the specialist American Board of Orthodontics. But in fact, as I show in this case, and I will show you in a minute the finish of the case, and then we can go, you know, face to face and see each other. But I believe that biomechanics, for example, is something which is mechanically. It's not intelligence. It's physics.
Yeah.
And when you deal about physics, when you move one tooth, you have action and reaction, like you can see here. You want to extrude a tooth or to expand the arch, you get a side effect. You get intrusion in the back when you do extrusion in the front, and you have a rollout of the molars and premolars when you expand. And this is something that is mechanically, it's automatically, it's physics. There is no reason that the machine will not help you to avoid it, will not help you how to plan it. And there is no reason to be afraid of it. And things will change dramatically because you will have to put your aesthetic vision, your perio knowledge, your integration, but not necessarily to understand a lot of biomechanics.
No, I completely agree. I completely agree. And as you can imagine, just Invisalign has 8 million cases done. And when you have one computer, the same system, the same computer, it's like one doctor that did 8 million cases, right? And it's like one doctor that doesn't forget anything. It's a doctor that doesn't forget, that understands every mistake that was done in the past, that understands the consequences of every decision. And you put all these together to actually help us, guide us through the process. So I completely agree. I completely agree that.
Look here, for example, at the attachments. You know, if you look deep, if you look shallow, they look like composite, you know, buildups in order to have more retention. But if you look deep in the shape, in the active area, in the bevel, in the angulation of the attachments, each one of them has a purpose in order to biomechanically either move a tooth or avoid a side effect, one of the two or both of them. So, you know, and everything, and by the way, most of them are automatically placed by the machine because you wanted 2 degrees of rotation. You wanted 3 millimeters of extrusion. So the machine learning is giving you these attachments. And people say, you know, so tomorrow they will go to Smile Direct like in America and propose, you know, a shop where somebody will come and scan and have some, you know, Invisalign cases done for them. I'm not afraid of it. I think you shouldn't be afraid that people will take the Smile, the DSD philosophy from you, because what you do is having the artificial intelligence with your mind. And there will never be a replacement for your vision, for how you see the case, at what speed you want to go, where is your aesthetic, vision. So all this, I think, if you look at this case, after 5 months, this is 5 months, totally 5 months of treatment. And I want to conclude with a very nice tip for our viewers. I believe that even in retention, you have this artificial intelligence knowledge, because when I know that these teeth there were a lot of open bite in the front area, as you remember, they are going with a tongue to relapse. So I placed here some attachments over here. We discussed the progress assessment, You can see here amazing feature that has the iTero
Yeah.
to see if my movement is accurate. So I use this progress assessment for all these purposes to see that biomechanics is okay, to see that the accuracy of my treatment plan. So you can see here that I got a lot of greens, which is 100% of the movements that I
Yeah.
planned actually happen.
I think this is so. This is a very powerful tool. I think this is the future of dentistry. Orthodontics is the first one doing what we call digital quality control. This is what we call
Yeah.
digital quality control, and we see that we are doing that on restorative. We are doing that on implants, but of course, this technology on orthodontics is so well developed. Explain to us exactly what is progress assessment and how
Yeah.
you use it.
It's as you said, an amazing tool that unfortunately not many people use it, even when they have the iTero and sometimes 3-4 iTeros in the clinic. This feature enable you in every moment, in every visit of the patient, to know that everything that you plan actually happened. They superimpose the scan. I scan the patient every visit. It takes my staff around 1.5 minutes for full arch plus bite. 1.5 minutes. That's the average in my clinic.
Okay.
And they can superimpose my plan. Patient is, for example, in aligner number 20. So we go to the machine takes the plan. I mark that I'm in number 20. So now the scan and the plan are superimposed, and I see colors, which if it's green, it's 100% what you plan. Yellow is around 10%. 90%, 10% less than the maximum. And not only that, you get a table which gives you exactly what happened. Where is this yellow? What angulation of movement of that tooth did not happen, is missing. Is it the extrusion? Is it the buccalization or the rotation? So that's an amazing tool, not to waste time, to do accurate, even to learn, because we want as clinicians, like if you do an implant and you want to see how the gingiva reacts, you have to wait. You have to wait around 1 year, 2 years, 3 years. Here it's a learning tool which is now. You can see exactly what you did and what you have.
I think this is going to become every modern high-end clinic in the near future will be doing this in every procedure. With the scanner, any procedure can be scanned and compared with the simulation. Since we preconize simulations for everything before you do any kind of procedure, for example, crown lengthening, we always do a simulation in 3D to show the patient and to discuss as a team and to define exactly where we want the crown lengthening to be. And since we have that simulation, of course, when we perform the surgery and the healing is over, it's very easy for us to do the same. You scan and you ask the lab to overlap and give you a report. That's what we do in the DSD Planning Center for every procedure to our dentists. We create reports of quality control of any procedure that we want to do. But automated like this in the iTero is just amazing. And as you said, I don't understand why more dentists don't use it. I don't understand why more dentists are not telling their patients that this technology is available, because this just generates so much confidence in the patient, so much tranquility, because they see the technology working for them. And you can show this image. Imagine on after 4 months of treatment, you show this image and you see like 90% of your teeth are exactly where we planned, and this and that are just missing a little bit here and there. And that's what we're going to do next. We're going to fix this. We're going to fine tune your treatment. This is unbelievable technology that generates a beautiful combination of better care and amazing marketing.
Yeah, but I can tell you that, and I'm sure you will agree with me that being in a DSD community where we are now, for me, 90% is important for me and not for the patient. I want to be a better doctor. I want to be a better orthodontist. I want to understand if what I plan actually happened. and the extra 10% will be to amaze or to inspire and
Wow. Yeah.
to do the wow effect for my patient. So now to conclude this small presentation, I want to show you, a nice tip of what I'm doing a lot with my Invisalign cases. I'm doing what is called active retainer. And for this case that has the open bite, I built a composite here. You can see like my own square attachments. And I created a plan where I have 13 attachments to have and more extrusion. So patient in the night can change a liner every month. And in case there is a little relapse, he changes and get a little bit more extrusion, which will be like a fight for the tendency for relapse. And this is again the interaction between the human and the machine. For the machine, I finish the case. But for me, as a human being who knows all the complexity of this case, I put here a lot of my touch for this case in order to have more stability and more aesthetic for many, many years. So just to summarize, for me, the artificial intelligence is really, something that is much more than, like a game or a funny thing. Let me stop my screen share. Let's see. I stop.
Perfect.
The share screen. Good. So now we are together. We have another probably 10 minutes. So stage is yours, Christian. Whatever you want to ask.
I want to ask you a couple of things. Yeah. First thing, what type of tooth movement cases you think with this technology, general practitioner, a restorative dentist, what a restorative dentist should do alone and what a restorative dentist should refer to their ortho specialist?
Christian, you are dealing with doctors like my good and your friend, me and your friend Nitzan, who is not a specialist. And Nitzan is doing today the best, Nitzan and Mirella, the best implants, the best tissue augmentation, and the best prosthodontics, not being periodontists and not being specialists in prosthodontics. So I believe if a general practitioner wants to understand, learn more deep about tooth movement, get this knowledge from the artificial intelligence machine, and not just getting it as a recipe, as a cookbook done by a technician from Costa Rica, and trying to do, for me, easy cases, Christian, are the most dangerous one. Because if you take what is called easy cases with a little aesthetic touch, and you don't make it from being okay to be perfect, you are in a very, very bad situation. If you take a very crowded case and a very shit case, and whatever you do, you get it better, and patient is happy. So Invisalign is suggesting for GPs, they have what they call Invisalign Go, which is like a simple version of Invisalign, and they have this limit. Until that crowding, until that expansion, I don't believe in it. I believe if somebody is moving tooth, he should understand what he's doing. He should understand about aesthetic. He should understand about bone, and he should understand about a lot of things. Like if somebody is sending you, a crown, you want him to understand about biological width, about a lot of things, about emergence profile. So to me, everyone who is really willing to learn, Invisalign and DSD and combination are great tools, but they will not replace knowledge. They have to know more about what they're doing.
For now, perfect. I completely agree. I agree on the two topics. First, that everything that is easy means you need a little bit of modification. It means you're starting from something that is not that bad. It means you can make it worse and get in deep trouble with your patient. I saw that happening. It happened with me. It happens with restorative dentistry when it's just a little bit to improve, and then suddenly when the patient has that bad smile, it's much easier to make the patient happy, and working as, if you want to move teeth, regardless of your title, you can go to orthodontic specialization and still not learn properly and be a bad orthodontist, or you can be a restorative dentist that really puts energy to really learn biomechanics and learn technology and learn how to move teeth, and then you can do a good job moving teeth. Technology is there to help.
Let me ask you something, Christian.
Yep.
How you see the future of DSD, smile design on orthodontics?
Of course, we have the philosophy is there, right? The philosophy has been already developed the day one when I really had the idea, when I learned about aligners and I saw the potential between 3D digital smile design and 3D orthodontics, and actually this integration is made out of 4 pieces. 2 pieces that Invisalign brought to the world, that is allowing us to move teeth digitally before even touching our patients. That's number 1 thing that Align allow us. And the number 2 thing that Invisalign allowed us was developing appliances that can actually translate simulations into real movement with a very interesting precision, and it only gets better and better every month, every year. So the simulation, the 3D simulation was there, and the appliance was there, the device was there. DSD had the idea of bringing to Invisalign the face, right? And there is the interdisciplinary approach, meaning don't only align, but move teeth in harmony with the face and move teeth to facilitate the other procedures, because a lot of cases need more than just orthodontics. So this was the idea, 5 years ago, but technology was not there yet. And since then, we've been working on the technology, and I see the future still making this philosophy that is so beautiful become more precise and easier. There's a lot of homework to do yet from the technological standpoint, improving the precision between the overlapping of the files, facilitating the process of the design being integrated with CleanCheck, also working called the Smile Check. That means allowing people to interact with the smile design the same way that you can interact with the CleanCheck suggestion, meaning you don't need to do all the CleanCheck work technicians in Costa Rica will do. You need to be able to be a great orthodontist to identify what is good, what is bad, and customize according to what you think is the best for your patient. So we are bringing this same concept to the smile design world, where we can design smiles for people. Well, we can allow a little piece of the technology to the dentist, so the dentist can check the smile design, modify the smile design, approve the smile design, and then the lab can continue the work.
I can tell you, and again, I'm sorry, Kyle, if you are listening to us or you'll see it later. For me, when I met Kyle in Australia some years ago, when he only started, we both lectured there, and he started with Gum Gum and Pearl, and I think that what he's doing now, what you do, Christian, is making our life more difficult, because we get more information. The data is pouring.
Yeah.
And what I think our mission as, people who try to inspire the dental world by our, teaching and communities, is to explain people that it's not that frightening. Yeah. It's not that complicated. But it's like when you drive, when we used to drive in the past, we didn't have too many cars, we didn't have too many traffic lights, we didn't have too many cars coming here and there, and having the alert here and the alert there, and all the lights, technology, and it's like a pilot. And when you get all this information, the machine just bring it to you. But still, when people are afraid from technology and afraid from machines, I can tell them that the more data that we will have, the more they will need us as
Yeah.
dentists, because we are the only one that will decide on what we integrate and how we interpret all
Interpretation and
this information.
I agree. Interpretation and action. You need to act on the information. And you're right. Today, if you compare a first appointment in a dentist, 20 years ago, the amount of information that a dentist was collecting compared to today, with all these amazing technologies that we have, the amount of data to understand that human in a much deeper way, to really, every general practitioner can have a clear understanding about possibilities, advantages of moving teeth, the airway, the TMJ, the muscles, the bite, the gum, the possible smile design of the future, the interdisciplinary possibilities. It's, as you said, the information is there, so we cannot pretend we don't see it anymore. We cannot pretend we didn't have access to the information. The information is there, so our responsibility becomes bigger because we need to act on the information.
Yeah, and I can tell you that, we have a mission in this world, of being, we are not that young anymore, at least me, but we have a mission that most young people, they're afraid from technology. They think it's too expensive. They're afraid, to invest in all this technology. And the more old people, they say we don't need it. So it's kind of, but it's here to stay. And I think that, these such coffee break that you are doing are so important. And I thank you from the bottom of my heart to hosting me today.
No, Rafi, it was great. It went really fast. I hope we will be able to have other opportunities to explore more in depth specific topics. We really want our community to become experts, or to really understand the advantages of moving teeth. I believe moving teeth can be something that is much more, it's better used by dentists in general. I think it brings amazing benefits to the patient. It is a beautiful option in so many cases, and we have amazing technology that can help us integrate tooth movement with beautiful restorations, beautiful surgery, implants, soft tissue management. So I really love this topic, even though I'm not an orthodontist. I said, the better I become as a smile designer, the more I love moving teeth. This is something that because that is true. I fell in love with the possibility of moving teeth many years ago as a technician, to allow me to develop better diagnostic wax-ups. I would call my dentist and say, look, if we move teeth, before the 10 veneers, I think there's so many benefits out of this. So I love learning from you guys. I'm a big fan of the orthodontic specialty. And I hope that we will have more opportunities to interact, my friend, and to share this type of topic. So your final message to our community.
Final message is be able to use technology to predict. I think the prediction is one of the best gifts we have today from technology. So let's predict our next meeting, Christian, and do it soon.
Fantastic. Let's do it.
Okay.
Thank you very much, my friend.
Thank you. Have a great evening, everybody.
You too.
Bye-bye.